This set of information will be pertaining to the gastrointestinal tract and diseases that we associate with this tract. This PowerPoint has a lot of slides and so much information is contained here. I think in many respects it's probably easier just to read through the text, the ebook on this, but I would also recommend everyone to have their etiology study guide that I provided back in a previous unit, the etiologies of diseases, so that you can follow along on that study guide as well as with the PowerPoints and or maybe your textbook readings. The student learning outcomes are also, I hope helpful for you to just sort of gear your study. But at this point, I think we've realized in these organ systems, you really want to focus your attention on the etiologies of diseases. So knowing when you hear about a microorganism that you know which disease it is associated with so that we would know effectively how to treat it. So I'll jump right into this because there really are a lot of slides. I almost feel guilty about keeping so many of these slides in this for you, but I have highlighted with either red, by red or either underlining or making bold some of the information that I think, I really want to bring your attention to. The beginning talks about mostly the anatomy and physiology of the alimentary canal. That's what people refer to as the GI tract, the gastrointestinal tract. They'll call it the alimentary canal. And there are many sections. It is including from your lips and your mouth, the throat, the esophagus, that muscular tube that connects the mouth to the stomach itself, the small intestines, large intestines, rectum, and anus, and then all of the accessory organs that are necessary that are secreting the products into the GI tract. You produce about 7.5 liters of secretions into a GI tract a day. You also take in about 2 to 2.5 liters of fluids and or food into that tract a day. So when you think about that, you've got about 9 liters of fluids, including those, and most of them being produced by these organs, that are helping the food to move through the system effectively so that nutrients can be broken down and absorbed. So this is a basic overview. I think most people remember this anatomy of the GI tract. So this is a basic little overview, I think a really good visual here of the accessory organs, the salivary glands, the liver, the gallbladder, the pancreas, which are all vitally important for the GI tract, and then the actual organs themselves. So we'll jump right in though and look at this. There's lots of defenses that we have. We are secreting IgA, which is a class of antibodies, into these secretions that help to protect us. We have microbiomes that help to protect us. There's constant mobility, moving things through the system. Our saliva has lysozymes that are going to be antimicrobial. The stomach is secreting acid, which greatly reduces the number of microorganisms once, food and liquid get to the stomach. That really reduces the number of microbes, but not all of them. And then bile is also antimicrobial. Bile is from the liver, we'll remember, and that has antimicrobial effects. So there are lymphatic tissues that are there just to act as sentry points that are looking for anything that's foreign and or potentially pathogenic. And then we have tonsils and adenoids. We studied about these in the lymphatic system. The appendix itself, even though we think about the appendix as being a vestigial organ, which means that it no longer really has a function, it is thought that it plays a role in helping to really kind of monitor which microbes stay in the large intestines. Remember, the appendix is that little piece of tissue that is found on the inferior, you can't see it in this illustration, but the inferior aspect of the cecum, which is the first part of the large intestines. So as food moves from the small intestines into the large intestines to be carried eventually out, this little appendix is a little piece of tissue just on the inferior aspect of that cecum. And while, again, we think of it as being a vestigial organ and not having a function, It is now being thought that it really does play a role in helping to monitor and maintain the normal microbes that are found in the large intestines. So commensal organisms live in the system, especially in those large intestines, helping to carry out that last part of nutrition, breaking down food, creating vitamins, helping with electrolyte, saving electrolytes into our system, and even returning fluids, water into our system. So all of those things are really important. There are so many different species that we know of and we're still learning about. There are bacteria, and you see some of the genuses associated with these bacteria. There are fungi, and there are protozoa, and all making up part of the normal microbiomes that are absolutely necessary in this system. It was thought that the stomach used to be sterile because the pH was so low. pH is as low as 1 on that pH scale, so it is incredibly acidic. But we know now that actually there are microorganisms that can withstand that, and one in particular we'll find actually plays a role in gastric ulcers. Gastric meaning stomach. Stomach ulcers, it is called Helicobacter pylori. So you'll see that on your etiologies study guide, and that is what causes gastric ulcers. You would never, people think that gastric ulcers are caused from stress, or stomach ulcers from stress or whatever. Now stress, because of the hormones that are produced during stressful events, and if you stand it too long, can reduce your immunity, which means that now your body can't fight off things, and things can take the opportunity to cause disease. And in that particular case, that can be something that precipitates or leads to it. But what actually causes the ulcers, the etiology, is a bacterium, Helicobacter pylori. The large intestines, again, is just filled with microorganisms. Again, many different types of species. There are even some people who actually are colonized with the Archaea group, which we tend to think as being that ancient descendants now are of the ancient domain of Archaea. But there are about 20% of the population that actually do have these, and they even produce methane. So anyway, the normal flora is protective. It helps with digestion. It helps to provide nutrients and supplementing our vitamins. There are so many things that the normal flora does for us. We even know that the composition, the balance of your gut microbiomes can even affect your chances of being obese or having autoimmune diseases. Much is being discovered on a daily basis about this, and it is incredibly interesting. And we are finding out more and more about this. And as we find this out, this would be an opportunity of maybe utilizing that information for treatment. So the highlight disease here is acute diarrhea. This is defined as, some people say they have diarrhea, but it may not be a medical diagnosis. It's 3 or more loose stools within 24-hour period. So that is what is considered to be as the medical diagnosis for diarrhea. And really the worry comes in when someone has chronic and/or acute diarrhea, is that when we see how many, especially infants who are so susceptible to dehydration, is how many people can become dehydrated, and that dehydration leading into medical shock, hypovolemia, that can then end up causing them to lose their life. So children often have diarrhea for many different reasons, sometimes viral reasons, and then that has to be addressed. Those symptoms need to be addressed. Sometimes you can't cure the etiology of it but you can actually definitely help with the symptoms by replacing the fluids. Sometimes it's accompanied by fever, abdominal pain, not always, but children who survive dozens of bouts of diarrhea, and pay attention to this because of that chronic situation, can lead to permanent physical and cognitive defects. So catching these symptoms early is important. Replacing those fluids, those electrolytes early is very important because it can lead to permanent damage. In the United States, it's often contributed to contaminated food sources. And you can see how this is just the sheer numbers tell us that this is of concern. Most are self-limiting. So the important thing to do is just making sure that you are replacing the fluids and being very concerned about doing that. And I will go through these because there are a lot of slides. Maybe you can go through them a little bit more at a leisurely pace as you are reviewing some of these. But we do understand there's some, as far as infectious diseases go, which we're concentrating on in this course, but certainly in this literature, we'll talk about some of the ones that are the most prevalent. Salmonella is a bacterium. There are quite a few different species of salmonella that can actually lead to what we call food poisoning, if you will. We often get these from poultry. We can get them from eggs. You can also get them from reptiles. So the salmonella is something that we do encounter. It is not that uncommon. It is a reportable disease to the health department. And Salmonella Typhi, you've heard of typhoid fever, I'm sure. Salmonella Typhi is definitely one that is reportable. In severe cases, it can lead to septicemia, which is an actively growing microorganism in the bloodstream. Now, obviously, that has a higher mortality rate associated with it. Milder forms of it is what we usually see, and that can have symptoms like vomiting, diarrhea, and abdominal pain can be associated with that. Death is pretty infrequent in the milder forms, but this is also how it can be easily transmitted through fecal-oral route transmission. So the virulence factor comes in that there's an endotoxin. Salmonella is a bacterium, a gram-negative bacterium that we know are associated with endotoxin productions. The infectious dose of this, when we look at the infectious dose of this is usually something that we're going to see again associated with food contamination, so meat, milk, easily contaminated. People being very careful in how they handle the food is going to be important in helping to prevent this disease. Shigella is another genus and bacterium, Shigella, that causing shigellosis. That's the name of the disease, shigellosis, just like Salmonella is a bacterium that causes salmonellosis. That is the disease. This can resemble some of the pathogenic Escherichia coli, E. coli. Frequent watery stools, fever. This usually has intense abdominal pain. Again, the culture is going to end up helping to diagnose this as well as some serology testing. So the difference, though, in Shigella and Salmonella is often the dysentery that's involved with shigellosis or Shigella infection. Shigella is going to cause a dysentery, which is diarrhea that has blood. Some people say they have dysentery, but they really aren't seeing. We aren't seeing blood in the stools, but that is what the definition for dysentery is. So this can invade. This bacteria invades into the large intestines rather than the small intestines, and then it causes an inflammatory response that can really lead to extensive tissue damage. And this is where that bleeding from the GI tract actually is occurring. If there's a toxin present, this is going to be responsible for more damage. And you can see, when I talk about extensive damage, you can see a normal lining of the lumen of the intestines here, but then look at the lumen of one with the Shigella effects. This is extensive damage that can lead to very serious disease and or death even, and then sometimes scarring and having to remove, as this one was, removal of those sections. So very small infectious doses are needed for Shigella. It is very easily transmitted from person to person. It is a fecal-oral route of transmission, so it is due to usually lax sanitation, crowding, malnutrition, and, hand washing. Just can't stress hand washing, how important it is to prevent these types of things. People can establish a chronic carrier condition that can last for months, and again, this is how it stays and being transmitted, is that someone has become a carrier. And again, lax sanitation and hand washing and that sort of thing can lead to these outbreaks, and it is a reportable disease. They try to go in and figure out where the index case is and trying to sort of shut this down. The best prevention is good food hygiene. So in uncomplicated cases, no antibiotics are indicated. This is kind of important because what we know is that sometimes when you are treating this, and of course you must treat if it's a complicated, serious case, but sometimes when we treat, we actually are extending the carrier phase, and so that that actually can happen. Again, this Shigella acts very much like these pathogenic E. coli's can act. So pathogenic E. coli's can produce much of the same type of toxins that Shigella, the genus Shigella, can actually produce. This is all on your little chart, so I would just refer you to just recognizing these names: Salmonella, Shigella, the enterotoxic E. coli's. So these are the ones that we think about really with food and waterborne disease and outbreaks, fecal-oral route types of contamination. Good hygiene is just so important in helping to prevent this. Food hygiene by cooking meats well, handling raw meats carefully, and how you should be handling them, cleaning surface areas well with this. And this is how we associate taking care of these and controlling these infections. There are at least 5 categories of E. coli that actually have this ability to cause diarrheal diseases. So these are, fairly common. There's another genus that we know is also common as far as food-borne diseases, and this is Campylobacter jejuni. It is a bacterial. It's one of the most common bacterial diseases. It's usually self-limiting. The symptoms can and may last a long time, though. This is when people seek out a diagnosis, is when they've lasted longer than a week, certainly lasting longer than 2 weeks. Somebody should be going and seeing about this. You can see it's kind of systemic. So headaches, abdominal pain, vomiting, fever. So this isn't just isolated to diarrhea and maybe the intestinal tract. This can lead to very frequent watery stools, and people can have really systemic kinds of symptomology from this. So they do seek out treatment. Something that we know that is, and again, ingested through food, water, milk, meats, chicken, these types of things. So handling raw meat really carefully, cleaning off surfaces really carefully, hand washing, very, very important. What we know can happen from post-Campylobacter infections is a syndrome that we see happening, and it's pretty rare, but we do see it, called Guillain-Barre. That is pronounced, this is silent, the G is silent, Guillain-Barre syndrome, GBS, and it is a progressively paralytic syndrome. So the paralysis comes on, and once it starts, it comes on sort of slowly, where there is this progressive paralysis that can even involve the respiratory muscles. So some people will have to be put, obviously, in the hospital and even ventilated until this syndrome, and for most cases, the syndrome will subside and even complete recovery will happen. In rare cases of Guillain-Barre syndrome, some of the paralysis can linger and can stay. So the thing to do is to prevent Campylobacter. So prevent these by trying to prevent these foodborne illnesses. and being careful with all the things that we know that can help with prevention of these foodborne illnesses. Because even though Campylobacter is self-limiting, the disease itself, there will be a few people who actually do develop this particular syndrome afterwards, and it is usually due to an immune system response that's causing this. Guillain-Barre isn't only seen after Campylobacter, it's also seen after other illnesses, including coronavirus, this pandemic that we're currently, dealing with now. So again, the goal is to prevent disease so that we can prevent some of these syndromes that we do know are associated with the immune system's response after dealing with some of these diseases that we do have preventions for. Okay, so antibiotic resistance, we know antibiotic resistance is happening in most of the bacterial diseases that we are dealing with these days, and this is again one of them. Clostridium difficile is sometimes referred to as C. diff infection. It's sort of abbreviated that way. You'll hear about it in the medical community. Clostridium difficile is what we know is caused from prolonged antibiotic use. So it is associated with prolonged antibiotic use, and it is called antibiotic-associated enterocolitis. It is also sometimes referred to as pseudomembranous enterocolitis. Pseudo meaning a false kind of membrane, because it sort of produces, if you look at a healthy, again, the lumen of a healthy tract, and then it produces this mucousy kind of membrane. The stools will end up looking like almost clear water. There's so much fluid being lost through the tract. The stools will look, when you collect it in a little container, will almost look like clear water that has like tissue floating on the top of it, really, like a lining of the intestines. It's a pseudo lining though. And the odor associated with this bacterium, because this is an anaerobic bacterium, it produces gas that, and some of the gases are really malodorous. So there is a distinct odor associated with the C. diff infection. The odor itself is almost diagnostic. Of course, we do the definitive test in the pathology department to get this diagnosis, where they're looking for the toxin and also doing PCR types of testing with this as well. So Clostridium difficile. Many are said to be healthcare associated because people are in skilled care facilities, they have been on prolonged antibiotic use, and then they develop them once they, sometimes they're still in-house, but sometimes they've actually gone home. This is very difficult to eradicate. So, because when you think about eradicating it, you know that you're going to have to actually give more antibiotics. And I'll refer you back to one of your discussion topics, which was actually using fecal enemas to help to reestablish the normal flora that should be in the colon. Remember, in that large intestine, you must have all of those microorganisms. They are protecting you from things like Clostridium difficile. So that's an important thing to be thinking about. There's another bacterium, Vibrio Cholera. Vibrio is a bacterium that causes the disease that we call cholera. And, this again this can be, if the symptoms are not treated quickly, replacing fluids, this can be devastating to a human body because of the massive loss of fluids in a short period of time. So that's why people are dying, which is really a real shame, because we know we can replace fluids as long as the people are in near a facility that can offer support with replacing the fluids. But their horrific death due to cholera now is due to the fact that it happens in areas where the water is not clean, usually after events like earthquakes and or hurricanes, and usually some catastrophic sort of event. and then people can't get to the people to offer them clean water sources. So they're having to drink the water that they have available. The water is contaminated. It spreads rapidly through the population, and then the infrastructure's been lost, so people can't get in to help them, and they can't get to medical facilities quickly enough, and they literally dehydrate. I mean, that's just a very, very sad thing. They're losing so much water through the rectum, through the intestines, that it really looks like water just pouring out. They can lose up to 10 liters in a day of water. It's said to be rice water stools because it looks like water that grains of rice have been sprinkled on, but really that's just parts of the mucous lining of the intestines. It's just coming out it's being lost so quickly. So untreated patients losing 50% of their body weight in the course of the disease, and you're talking about days. So, we know that in a human we have as much as 40 liters of fluid normally inside our cells, outbating our cells, all the secretions we have. So imagine losing that much fluid in that short period of time. Your body, your cardiovascular system can't handle it. So literally the heart stops. And so, hypotension, low blood pressure because your blood volume's bottomed out. Your heart is racing to keep up with it. The heart can't keep up with it, so your tissues are suffering. They can't push the blood around. So your tissues are suffering for oxygen. You're becoming cyanotic. And shock can happen within a day or two. So you look at that. Mortality rates between 55 and 70. This was horrific before modern, technology, getting people to these areas quickly to help save lives from this. This was like a major cause of death before modern medicine. We tend to take for granted, how living in a modern world, we don't think about this too much anymore unless there has been some sort of catastrophic event. And now, resources trying to get to those areas quickly to provide clean water. So you can read more about the Vibrio Cholera, a bacterium that causes the disease we call cholera, and look at that transmissibility and the epidemiology of that and preventing, really preventing that. Prompt replacement of water and electrolytes. The kids are the most at risk. And thinking about this now, kids that receive no treatment, as many as 3 million dying a year. So oral rehydration is also very, very important. You don't have to have IVs as long as you have clean water that you can give them to drink. So administering this can really restore people. It's probably one of the most tragic things you hear here is about cholera, in that we do know it's caused from bacteria, but we also know we can save lives if we can just get people clean water. So just really important for that. Cryptosporidium is a protozoa. So this is not in the bacteria. We've been talking about bacteria. This is protozoa now. It can mimic a lot of the other causes for gastroenteritis, so headache, sweating, vomiting, cramps, diarrhea. So all of this, it's a lot of the same thing. In Cryptosporidium, we know that this is found in soil because it is in the intestinal tracts of domestic and wild animals. So it is kind of considered a zoonotic disease. What we know, we try to do though is treat our water. So treated water sources in towns and cities and whatnot can help to take care of this. We know that it can be associated too with swimming pools if they have not been treated effectively. And, this is one that Cryptosporidium outbreaks will occasionally see. And again, they're linked back to a water treatment site that was not effective. I think one of the last outbreaks we saw was in Milwaukee, and that was quite a long time ago, but more than 100 people died and hundreds were sickened from that. So were ill because of it, and it was due to a breakdown in the water treatment plants. So Rotaviruses are so common. Rotaviruses are very, very common, especially in young kids. And this can, again, fecal oral route of transmission. But this can lead to diarrhea that is prolonged. So if the diarrhea is prolonged, we said especially children are very much at risk for things like that affecting them, their physical growth, but also their cognitive growth as well. So, you know, we are concerned about rotaviruses, and rotaviruses are on your little etiology study guide. We're not just concerned about it in areas of poor sanitation. We see this in developed countries as well. It's a fairly common diagnosis for children, especially that have chronic diarrhea. Noroviruses are also incredibly common, so we see those. They cause a profuse watery diarrhea that lasts for days, and you know, the treatment's rehydration until the body can kind of take care of this. So the symptoms come on rather quickly. People say they've had food poisoning, severe nausea, frequent vomiting accompanied by diarrhea. Both are happening, and you know, they can be caused from viruses, but also these bacteria. Probably the most common causes are these bacteria. So dairy products that have been left out too long, meat products that have been left out too long. The symptoms are usually pretty violent. They come on rather quickly after the food has been ingested and the incubation short, and then usually they are going to resolve within like 12 to 24 hours. So they are self-limiting. You might feel like you're not going to survive it, but they're usually self-limiting. So proper handling of food, proper cleaning of surfaces, hand washing, storing food at refrigerated temperatures, those types of things in the right way can help to reduce the numbers of these types of events from happening. I think almost everyone has had this type of food poisoning before, where you are really sick for that 6 to 12 to 24 hours, and then the symptoms go away almost as quickly as they came about. But the antibiotics, you really would not want to do those, because they, again, can sometimes actually prolong the symptoms. Bacillus Serous, this is again a very common kind of toxin that we encounter that is usually going to be associated with vomiting and or diarrhea, and it is in the soil. So, you know, again, proper handling of vegetables, cleaning the vegetables, and that sort of thing. We can look at some of these food poisoning. Clostridium perfringens, again, Clostridium perfringens, B. serous, Bacillus Serous, Staphylococcus aureus. These are probably the most common causes of those short-lived types of food poisoning events. Now, chronic diarrhea is a different thing. Something lasting longer than 14 days is considered a chronic diarrhea. Now, irritable bowel syndrome, which I know everyone has heard of, or ulcerative colitis, these are not caused by microorganisms. The incidence seems to be increasing in this diagnosis, but these are not associated necessarily with that. So we do have people who suffering from AIDS that have chronic diarrhea, but it's usually from an opportunistic microorganisms, things that are part of your microbiomes that are now taking the opportunity because the person has a secondary immunosuppression, immunocompromised disease, whether it is from AIDS or whether it is from cancer treatments or drug abuse or, sometimes even old age. So those can lead to that. And again, we talked about some of these E. coli's that we know can also lead to chronic kinds of diarrhea situation. Cyclospora is a protozoa. It's common, so it's, again, most cases are associated with fresh produce or water that's been contaminated with feces. It's worldwide. And you can see outbreaks usually linked to certain products that have been shipped across the country sometimes, and so they'll have these recalls of certain products because of these types of outbreaks. Giardia Lamblia is actually, and this is Sam duodenalis, this species, this genus, Giardia, is endemic to this area. It's actually, it's very common. It's a protozoa that can lead to intermittent diarrhea, abdominal pain, that sort of thing. It is, again, a protozoan that lives in the upper part of the small intestines called the duodenum. The small intestines has 3 sections. The first section is the duodenum. The second section of the small intestines is the jejunum, and the last section of the small intestines is the ileum. Well, the first part is called the duodenum, and this is where this protozoa will reside, and it can cause a diarrhea that's a long duration, associated with abdominal, usually upper, because of the upper duodenum area, upper abdominal pain, and flatulence, which is an excess of gas production. Again, supposedly the stools have a very distinctive kind of malodor. So, stools don't smell great anyway, right? But sometimes, like with the Clostridium Difficile and with Giardiasis, which is the disease we associate with Giardia, there's a very particular kind of malodor that's associated with them. Usually there's no fever, and it's usually chronic. So if somebody's had chronic diarrhea for a long time, then this is something that needs to be considered. And what they need to do is a stool sample looking for these particular protozoa and seeing these cysts or trophozoites in, this is a cyst, these are the mobile parts, the trophozoites, and seeing those would be diagnostic of Giardia infection. So again, avoid drinking water from freshwater sources that have not been treated. So spring water, creek water, and even well waters have been known to be contaminated with this. So, that is where people typically get it, because this protozoa lives in most of the GI tracts of domesticated and wild animals. So they are, to just put it succinctly, they're pooping on the ground. Rain takes that stool toward the creeks and toward the groundwater, and that's there, that's in there. So clean water sources. We take clean water for granted, I think, right? Amoeba histolytica is a protozoa that we see from South and Central America. So usually there has to have been a history of travel if people are coming to our area with this. So, but this can be a significant protozoal infection because it can actually it has a mortality rate associated with it if it goes untreated. So this Amoeba histolytica can cause people to be fairly sick. You can see the erosion of the intestines here, and the bleeding that actually can occur here. And these trophozoites, when you see these in the stool culture in pathology, this is how this would be diagnosed, you can see that the trophozoites are actually eating the blood. They're ingesting the blood, the human blood. So it can cause these, certainly can cause these ulcerations that can last. Now, we can go through, again, severe, if it's a severe form, you can see, mortality rates being pretty high in those severe cases. So in developing countries, we know that a lot of people actually have this, and it can kill a significant number of people a year. Night soil is what we call human excrement, and many places and cultures, and even here in the United States, night soil has been used to fertilize crops. So humans are more at risk for infectious diseases from other humans and other human, excrements, whether it is saliva, blood, urine, feces, genital secretions, whatever. Humans are most at risk from other humans. and what they can catch. So certainly it would make sense that night soil being used as a fertilizer, it would lend itself to be a mode of transmission for some of these infections. So I have a lot of slides on that. I'm not sure why I kept all of those, but okay. Now our mouth is filled with normal microbiomes, and they are mostly friendly, and they're actually keeping pathogens at bay and competing with pathogens. But I'm sure that you've heard before that really our health begins with our oral health, our mouth health, because this is seeding many of the other areas of our body. It can even seed places that should not be seeded with microorganisms like your hard valves, right? So, it is really important to maintain good oral hygiene and good oral health. So dental caries, which is what we call tooth decay. So cavities, the medical term for cavities is dental caries. That's the medical term for cavities. This is the most common infectious disease in human beings. It is typically caused from a bacterium known as Streptococcus mutans. I'm sure that's in the next slide or two. But Streptococcus mutans. So it is caused from usually from this particular microorganism. And we know that this microorganism loves sweets, sugars, especially simple sugars. So this is why it is so highly recommended that you limit how many simple sugars are in your diet, but that you also, practice really good oral hygiene by, after having, if you do partake of these, which are some of my favorite foods, the sweets, is that you really carefully brush your teeth and whatever afterwards, because this is how it begins. And you can see the stages of plaque formation. And we have talked about plaque before. So looking at these, lots of pictures I included here. So if you don't really remove plaque quickly, it turns into a hardened type of cement-like substance. So it's just important that plaque formations, people have routine cleaning and then even professional cleaning of that to help to prevent those. So I'll let you all read through some of that. You will see Streptococcus mutans, I think, on your etiologies list. And you know that for cavities, the treatment's going to have to be removing that lesion and then replacing it with a filling, what we call a filling. So good. Periodontitis, this is the beginning of it is gingivitis. Gingivitis is inflammation of the gums, and then it can lead to periodontal disease. And this is the most common reason for actual tooth loss, is periodontal disease. And what is happening here is the gums are pulling away from the root of the tooth and breaking the ligaments that are holding the root of the tooth to the bone, the mandible, and the maxillary bones. So now the tooth is losing its protection and it's loosening, and this is really one of the most common causes of tooth loss, is actually periodontal disease. And so you can see the gums become inflamed, there are pockets of spaces between, and then the bone is lost. So with severe bone loss, the tooth is going to loosen. So this illustration, I think, does a good job of that and showing that. Preventing that is trying to prevent those biofilms, and again, just good oral hygiene and health. Mumps is a disease that we're unfortunately seeing on the rise again because of people not getting enough immunizations that we have herd protection of our populations. We saw almost none of this in the United States over the last 30 years, but now in the last few years we're seeing outbreaks of this again. This is a preventable disease with immunization and herd immunity. So what this virus does, this is a virus that actually attacks the parotid salivary glands. You have three sets of salivary glands. You have the parotid glands, which are here, where my two fingers are. You have sublingual, under your tongue, here, and submandibular glands. So you have sets of these 3 glands. The mumps virus attacks the parotid. So you get this chipmunk, they swell, and you get this chipmunk-like appearance. It's very diagnostic of this. And with that, you know, it's actually respiratory borne. You get these gopher-like swelling cheeks. But it can also become systemic, you know, and so the testes, the epididymis can become involved. And so in young males, this can descend from the salivary glands to the testes, and it can actually, usually there's no permanent damage, but when this happens, it can lead to infertility. So the thing to do is to prevent mumps from even ever occurring, so that you can prevent these secondary things that can occasionally happen that can be devastating to people. So most cases are in young kids because most older people have either had it or they are immunized against it, and so they have protection because of that way. So the measles, mumps, and rubella vaccine, that's what MMR stands for, the measles, mumps, and rubella, all of which are viruses that cause those diseases, are given in young kids, and then they're boosted later, and so this can prevent all of this from happening. So those are those. Gastritis, inflammation of the stomach, and gastric ulcers, which means there's actually an ulcerative lesion, caused from Helicobacter pylori, which I mentioned early on in this little lecture. So this was an amazing discovery. The people who discovered this won the Nobel Prize for this, because what we know is this: stomach cancer, which has a horrible prognosis for survival, by the way. Stomach cancers are caused from stomach ulcers. And now we know that stomach ulcers are caused from a bacterium that we can treat. So as long as, because we know this, we discovered this, we can prevent people from having chronic stomach ulcers. And so that means we can prevent and reduce the deaths of stomach cancers. And that was worth winning the Nobel Prize for that, because that's phenomenal. So again, it's a, you know, gastritis, this is sharp burning pains from the abdomen, not just a chronic bellyache. You know, this is painful, and it can be associated with bleeding. So you can see people with blood in their stools, and this is why stools are often checked for blood if there's any suspicion that there's a stomach ulcer. By the way, sometimes the blood isn't obvious. So it can be just that the stools are darkening. Or, you know, it's not going to be obvious like fresh blood. It's sometimes just that the stools are darkening. If there's any suspicion, you should do an occult blood test. And occult bloods are looking for blood in the stool. And so, you know, most common cancer in the world is stomach cancer. And this again is just so important that we know this and that we can treat this. And we can cure stomach ulcers. Cure stomach ulcers, not cancer. Cancer is a different disease. But ulcers, and if we can prevent those ulcers from happening again, you know, to that person, if we know they're susceptible to them and we can watch and be proactive and keep them from happening, this is reducing the number of stomach cancers. So, a wonderful thing. Again, you can look through some of these and see that the treatment is going to be a regimen of antibiotics. People can get them again, so it might end up, you know, it might end up being another, you know, they have to be treated again. But still, we do know we can treat these. Hepatitis is defined as inflammation of the liver. I hope, by the way, because I'm almost at an hour here in this lecture, I'm going through these slides, but I hope you all break these lectures down and maybe stop, you know, or take breaks even a day in between, because we know it's better for you to do that. You can actually get more from shorter lectures than you can from long ones. I'm just doing it all at the same time so that I can provide it for you here. But I'm hoping that you all stop and start these. But let's go in and talk about inflammation of the liver. We said the liver was one of those accessory organs to the gastrointestinal tract, and it certainly is. It's absolutely necessary for digestion, but it is so important as well for blood filtering, for blood clotting factors. It has so many different functions the liver does. But in this case, we're going to look to see how it produces bile, which is a byproduct of hemoglobin breaking down, and how that bile itself is part of the digestive process to help to emulsify, break down and emulsify, and with the absorption of fats. And fats are necessary for us. We have to have enough fats each day to be able to make the vitamins that we need, and to be able to make all of the hormone, the fat derived hormones that we have, which is an entire class, and those are just some examples. Our plasma membranes are mostly fat, so we need this. If someone has inflammation of the liver, often what will be a first sign is a yellowing of the skin and the sclera of the eyes, the whites of the eyes. So this is due to a bilirubin accumulation. Bilirubin is a byproduct of hemoglobin breaking down. And as hemoglobin, that molecule that's so necessary inside of our red cells, as we break that down due to the liver enzymes, bilirubin is an intermediary product. If the liver's functioning, it breaks bilirubin down to bile. No problem. But if the liver's not producing the enzymes it needs to break bilirubin down, bilirubin starts to build up in the bloodstream, and it is neurotoxic. Bilirubin is neurotoxic. So as that amount is increasing in the bloodstream, it's poison to our nervous system. Nothing about that sounds good, does it? So when someone has inflammation of the liver or liver disease for whatever reasons, that is of a huge concern, that the body is not able to get rid of this, and it becomes a burden to the nervous system. That's one of the things we worry about. Now, it can be caused from a lot of different viruses: cytomegalovirus, CMV, EB virus, the Epstein-Barr virus. This can be caused too from this hepatitis viruses that are usually, they use letters A through E, but they're actually even more than that. But A through E are major concern. It can also be caused because of autoimmune diseases. It can be caused because of drug abuse and use. Even therapeutic use of drugs can harm the liver. So this is why sometimes when you are given a drug, you're told to go get your liver enzymes checked routinely, because they know that it's putting a burden on the liver. And if there's indication that the liver is struggling, then they usually have to stop that drug. And certainly, like I said, even legal drugs like alcohol is a major factor. So these would be non-infectious conditions, but we're going to concentrate on the infectious ones, especially hepatitis A, hepatitis B, hepatitis C, and D and E. So we'll look at those. Now, these hepatitis A and E, both fecal-oral route transmission, again, food, water, contaminated sources with humans, poor handling really, but, hand washing. And, I don't want to make this derogatory toward people who had this to think, oh, well, they had poor hygiene. No, this happens. We live in a microbial world. So sometimes even being as careful as you can be, you can still transmit, but certainly we want good practices in place to help to reduce the numbers of these. When hepatitis E virus infects pregnant women, it causes up to 30% of a mortality rate. So, we've talked about this idea that there are some things that are, you're more susceptible to being pregnant, and or your fetus will be. So that's something to just think about. I don't think I asked you about that, but just something for you to know. Anything that attacks your liver, virus and or otherwise, is not a great thing, but these are really some of the more common ones. So hepatitis A and E, we tend to think about with unhygienic food handling. Eating shellfish, which I think, many of us do. It can be sexually transmitted, traveling to other countries where they don't have the same protocols for their water, stringencies for like water sources, and certainly being in overcrowded conditions where one person being susceptible that can then become a carrier and transmit it. So to many people with crowded conditions. So again, there can be asymptomatic short-term carriers and even people with clinical disease. But typically what we're going to do, we're going to track back this and try, in epidemiology, we're going to try to figure out if there's an outbreak, where it's coming from, and try to get back to it. There was a recent outbreak in Roanoke, Virginia in the last few months where a few people died, and it was linked back to one restaurant waiter at this particular restaurant. And, you know, dozens of people were ill, many were hospitalized, and a few died from this particular outbreak. Hepatitis B virus, hepatitis B, and hepatitis C are viruses that we do think about as being ones that we do know can lead to later, can lead to the liver failure and cancer of the liver. So these are ones that we worry about for that reason. And so again, preventing, you know, these things are what we try to do. Healthcare providers are going to be required, and you can use the word mandated if you want to, but anyway, somehow that offends people, but required to be protected from hepatitis B, because this is probably the one that healthcare providers are the most at risk for. And it's because of how this survives on inanimate surfaces, how it doesn't really take a huge dose of it. You know, there are a lot of factors that make this the most, really the one that you should be really the most concerned about as a healthcare professional, but not if you take care of yourself, you know, and get immunized, and then also use good practices in the work environment. These hepatitis B and D both, hepatitis B virus and hepatitis D virus, they both directly damage the liver cells, plus they can do some systemic, they can show some systemic effects as well. The hepatitis B, it can be life-threatening, but in some people it actually is even asymptomatic, and they just become carriers of it. Some can develop chronic liver disease and cirrhosis, which is going to be that scarring and hardening of the liver that can lead to the liver failure. You cannot live without a liver, so that is going to end up needing, needing a liver transplant. It can also lead to liver cancer. So these are ones that we do know are associated with this. When we think about children, they are getting this. They are at significantly higher risk of long-term infections and diseases. Look at this. 90% of the neonates and 30% of children will develop chronic infections. And this is, again, why we protect ourselves as adults so that we can protect our children from ever getting these. Because what we know is that this is the finding that leads to the justifications of routine vaccinations for us and children. Mortality rates are as high as 25%, 1 in 4, with chronic infections. So again, this is something to be concerned about. Not afraid of, but just aware of and concerned about, and understanding what protocols are in place for immunizations. So again, I'll let you look through some of the symptomology of this and the pathogenesis of this, and look at this. So this is one I think older generations called this serum hepatitis, serum sickness, or serum hepatitis, but it can lead to the risk of cancers. So I have a lot of slides on that you can look through. The prevention is vaccination. So, and you see how it is, now recommended for newborns even, and many clinical places are actually given the first dose of this before an infant neonate would leave the hospital. So, treatments, there's no drug that's a cure for this, but the symptoms are going to be treated and managed to help to support and save lives. Interferon is going to be given for both B, D, and C, by the way. And then also some antivirals can be given to help to lessen the course and the extensive damage that can sometimes happen with those viruses. Hepatitis C virus is called a silent pandemic because so many can actually have it without knowing until symptoms develop years later. It is liver failure from hepatitis C is the most common reason for liver transplants in the U.S. So that too should be sort of staggering to you there. And this is why you've probably seen commercials where they suggest that people over the age of whatever, 40, get tested for hepatitis C to see if they're one of those people who have it and their symptoms just haven't started yet. So now there have actually been some drugs that have had some very promising use in treating hepatitis C infections, chronic infections. But we do know that, again, hepatitis B and hepatitis C are both associated with developing liver cancer later in life. So the way you acquire it is very similar. Blood transfusions, drug users, vertical transmission is also possible. Vertical through fetus, mother to fetus. No vaccine yet, but anyway, so those were some of the viruses. Now we're going to look at helminths or worms, and this will finish us up here. We have, again, I'll have you refer to your etiology study guide. We have 3 categories: roundworms, flukes, and tapeworms that we think about. They're incredibly diverse around the world. There's some that are endemic to our regions, and some that you would have had travel to if you've come back to this region, if your patients have come back to this region, or if you are practicing in other regions where you know they're very prevalent. You would really want to be keeping these helminths in mind when you are treating. Now, as far as some of the things that we see with helminthic infections, we're going to see an eosinophilia, which means that those white blood cells, eosinophils, are going to increase. They increase with allergy and parasitic infections. We know that they're acquired through fecal-oral route transmission or through penetrating the skin. So most of them spend part of their life cycle in the GI tract, and this is why we talk about them here. Some of them we could actually see in sputum. We could see them in other cultures as well, cultures from other systems like respiratory and whatnot. But typically, this is where we're going to be getting cultures from. We're going to be looking for ova and parasites in the stool cultures, and/or we're going to be thinking about screens looking for these worms in these particular, and the GI tract. So there are 4 different life cycle transmissions that these parasites can have. I don't ask you to learn which is which for each of these, but there are 4 different cycles. And depending on how the cycle is, actually depends on how quickly and how transmissible some of these things are as well. They have many adaptations to survive. You know, parasites really want to survive in their host. They don't really want to kill their host, because if they kill their host, then they die too. So they have, they've evolved, and they've evolved along with their host. They have specialized, many of them have specialized mouth parts for attaching to the tissues, the inner linings of the intestines. Some of them produce enzymes that liquefy and penetrate the tissues so that they can actually enter into them. They have coatings that protect them from our immune response. Sometimes the worst thing that happens, the damage that's happening to us when we get a worm, is our own immune response and when we sense it. So the damage is coming from our immune response sometimes. So again, the most common diagnosis is going to get a stool culture, and you're looking for the ova or the parasite itself. So you're looking for their eggs, or you're looking for the worm or parts of the worm that might have come off. The blood count showing, you're looking at hematology, tests showing the eosinophilia, where eosinophils are increasing. Serology tests are always so important. So serology testing, and then listening to see if there's been a travel to an area where we know has a really high prevalence of some of these, and/or listening to just the history of not just travel, but also like what's the person's diet. Maybe they eat a lot of raw fish, or they eat, maybe that's their part of the culture. Maybe that's what they do, and that's going to set them up for having more of a predisposition to having one of these particular types of infections. So the thing to remember, there are no vaccines for these, and when we think about treatment, these these worms have very similar cells to our cells, and because of that, therapeutic index is really low, meaning that the drugs that you're going to treat these worms with are going to be pretty toxic to you as well. So you want to know what you're doing. You want to know what you're treating. You don't want to give a drug that is so toxic to the person if they don't need it. So it's really important. In some cases, the worms are going to be blocking the GI tract, and they're going to be so extensive that it's going to require surgery to remove some of them. I've seen that quite often. So where surgical intervention was actually necessary. So Anaerobes formicularis is the most common worm in children in any of the temperate zones. This is what we call pinworm or seat worm. You've heard it called pinworm or seat worm. It is really very common everywhere here. So the adult worms are tiny, no larger than much more than like a grain of rice. The eggs are going to be hatching in the small intestines and then migrating to the large intestines where the adults actually mate, and then lay their eggs in the perianal area. So the test for this is actually a little test. It's called a Scotch tape test. It's by pressing a piece of adhesive tape around the perianal area, just patting it, then looking at that under a microscope, looking for the eggs that have been laid in that area. Because they lay in that area, it causes an intense anal itching. Intense. And so if they're, you see children really, really scratching at this area, and or if there's any irritation, you might want to suspect that it could be this. If there's a diagnosis made, it is so contagious because these eggs can be airborne when people change clothes, or sheets. They can be in the sheets, bed sheets. They can be in clothes. It's very, very contagious. So if one member is diagnosed, the entire family gets treated, and all of the fomites, the bed linens, the undergarments especially, but certainly clothes and that sort of thing. So everybody treated at the same time. Trichuris trichurii is called whipworm. This is the genus and species. Again, this is pretty common too, especially in tropics and subtropics. It can actually cause a localized hemorrhaging of the bowel, in more serious cases. You see this in animals, probably in pets you've seen this before. In very serious cases in children, it can cause erectile prolapse, and if you don't know what that is, if you think about a sock that you put on the foot, a sock, and you think about putting your hand in a sock, okay? A prolapse is when part of that lining comes out the other way. So if you take a sock and you inverted some of it, put your hand in and pulled out part of it, that's what the rectum looks like. So you can see this, and that is very incredibly painful. Like, you'll know it when it happens to your child, if it happens to your child. But it can also be a dangerous situation and has to be fixed and also figured out why it happened. But having these worms that can indicate that. That's not the only time we'd see rectal prolapse. Rectal prolapse can happen for a lot of different reasons. Okay. And Diphyllobothrium latum is the largest tapeworm, up to 30 feet. So as large as your small and large intestines. This thing is big. This is pretty common in the Great Lakes, Alaska, Canadian regions. It can cause very long-term symptoms. It's from eating raw foods such as sushi and, that are made from salmon, so raw fish. I don't know who likes sushi. Some people do. Actually, a lot of people like sushi. Hymenaleptosis is actually a smaller tapeworm, and again, this is the most common one. These smaller tapeworms are the most common ones in the world. And when you see how long they actually are, these are a couple of different species of Hymenaleptosis. They're still significantly long. So, but these are the smaller kinds of tapeworms. So you can look through some of that just to see. There's a pig tapeworm called that we associate with pork or pigs, Taenia solium. Taenia solium. The thing about Taenia solium, and the thing to worry about, is we don't see it so much in developed countries anymore because of our meat processing plants and all the protocols they must go through to be approved to sell pork. But there's still families that are raising their own meat sources. They still are those happening, and this actually could happen. It could happen. So anyway, Taenia solium is one that we think about. This has you can see how long this tapeworm is. It has a little head that has these hooks in it that actually hook to the inside of the intestines to hold on. And really, all this thing is doing is just really laying lots of eggs in there. The problem can come in when you eat meat that you've eaten the pork meat that have these larvae, these worms, that have encysted in the muscles of the animal. And now these, you have something called cysticercosis, which is the illness that these cysticerci actually form. And when this actually happens, cysticercosis can actually, the human can become the host for this. And this is actually considered one of the 5 neglected parasitic infections in the U.S. In the U.S. now, we are not looking for, when it says neglected, it means we're missing them. We're not looking for them as much as we should be looking. We have a lot of people that are immigrating and emigrating, moving around from areas and that have different cultures and different, eating things and whatever. We need to be thinking about these more than we are, because we do know that we're missing them, especially something like Taenia solium that can actually migrate into the muscle areas and infect these organs. It can even go to, you can even get these lesions into the brain. So it's estimated, this is shocking, it is estimated that about 10% of the seizures are often said to be of unknown origin, but it's estimated that as many as 10% of them are being caused from these cyst lesions in the brain because of cysticercosis. So this is something that you do want to be thinking about. Schistosomiasis is caused from a fluke, a liver fluke, that actually is something that is considered to be very, very common, and it's been around for a really long time. The thing about this is that this particular one has a intermediate host that is a snail that is only found in Asia. So there has to have been some sort of travel or some sort of reason that the person has actually, been, these are the intermediate hosts that have been to these regions. So otherwise, if you get this, it's not going to end up lasting. So, but it is pretty common. So schistosomiasis, if someone has had that travel history to our country. So it kind of cloaks itself from the host bloodstream and from the defenses. So this is how it allows it to remain in the host for sometimes really long times. Schistosomiasis around the world, second most prominent parasitic disease after malaria. So we know malaria is caused from a protozoa, and schistosomiasis from a helminthic fluke, right? But very, very common, especially in areas, as I said, in the Asian types of areas and in Africa as well. So this is our end of our discussion of the GI tract, which has a lot of microorganisms that we have mentioned: bacterial, viral, protozoal, helminthic. So we've mentioned a bunch of these, and this little slide actually sort of puts it in a nutshell. Hope you've enjoyed that. There is going to be, I think, one more recording, and thank you all so much for your attention to this.